I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
When?
Right now, yeah.
Yeah, when?
A couple of weeks ago, I started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right. I'm not going to get hurt by it.
By now, you've probably heard the president say that he's been taking hydroxychloroquine, a drug used for things like lupus and malaria. Now, I want to play more of what the president said yesterday, and it gets, frankly, even odder.
This is a pill that's been used for a long time, for 30, 40 years on the malaria and on lupus too, and even on arthritis, I guess, from what I understand. So it's been heavily tested in terms of, I was just waiting to see your eyes light up when I said this, but, you know, when I announced this. But yeah, I've taken it for about a week and a half now, and I'm still here.
Can you explain, sir, though, what is the evidence that it has a preventative effect?
Here we go. You ready? Here's my evidence. I get a lot of positive calls about it. The only negative I've heard was the study where they gave it, was it the VA, with, you know, people that aren't big Trump fans.
Not sure where to start here when it comes to fact checking, but did he just say that veterans are not Trump fans? But I digress. Now, the VA study that he referenced was far from the only testing done on this particular drug. The VA study Trump referenced, people who took the drug had a death rate twice as high as those who didn't. It was funded by the National Institutes of Health, but was not peer-reviewed. Foreign studies of the drug showed elevated numbers of patients contracting a heart condition that could prove fatal. Also, the FDA issued a warning about the drug, another thing the president didn't mention. Quote, hydroxychloroquine has not been shown to be safe and effective for treatment or preventing COVID-19. It can cause abnormal heart rhythms and dangerously rapid heart rate. I want to bring in my guest who has studied the drug in question here, Dr. Lior Jenkelson. He is a cardiologist at the NYU Langone Heath. And doctor, first of all, thank you for the time, but I'm curious, were you as shocked as the non-medical layman like myself when you heard the president volunteer, oh, by the way, I'm taking hydroxychloroquine?
I only heard about this afterwards. I didn't hear it live, but I guess I was somewhat surprised, but I wasn't shocked. I think many people are taking the medication currently. So in that regard, it's not so surprising.
But I guess for the public, when you have the FDA put out their position on this, there have been studies, not overly expansive, but still studies on this that at least raise questions about the efficacy of the drug as it relates to COVID-19. You wonder where the science part plays in. When the president said before, there's nothing really to lose or there's no downside to taking the drug, I hear good things. The science hasn't necessarily confirmed that in any way, have they?
Right. I think it's a good question, and I think that there are a few important distinctions that should be made here. The first one is that indeed hydroxychloroquine has been used for many years. In multiple conditions, including for infectious diseases and arthritic diseases, and typically without a high rate of complications. So that part is true. The other thing we should clarify is that when we are talking about COVID patients, these are probably not the typical patients that would take the drug in the normal circumstances, meaning they are sicker patients. They have other comorbidities. They have other features that would increase their risk of getting into trouble with that medication. Now, the third component, and if you allow me just one more minute, some studies, including the studies that we have performed at NYU that confirmed some degree of risk associated with the medication, were done on inpatients, meaning patients who were admitted into the hospital. And so they probably had a more substantial, more aggressive, COVID-19 disease. We have not shown the risks that are associated with the drug in an outpatient setting, meaning we haven't studied what's happening to an individual who is in a better condition, taking the medication either for therapy or for prophylaxis. Last thing I want to say is that there are currently multiple clinical trials going on actually looking at this particular question. What is going on with patients who are taking the drug prophylactically and in the outpatient setting?
That brings me to my next question, which is, we've even seen that Arizona couple, for example, who had heard what the president had to say, and unfortunately, one of the spouses lost their lives in taking a drug that they didn't get the proper guidance on. I've heard from people who have lupus who say, when the president says these things, I'm concerned that I'm going to be able to get my medication because there could be a run on this. And then also people taking this drug without proper medical supervision, if at all, or trying to jury-rig some home remedy that will replicate it. Are you worried that science is taking a backseat and the proper medical channels could be some way gone around here?
As a medical professional, that's regardless of any medication. It's always important to stress that medications should be only used according to their proper intended use, and that is typically based on clinical trials and good evidence. So I think that's always a concern, and especially at times like that when there's a lot of fear and anxiety in the population. It's best if medications are taken by indication and when they're thoroughly studied.
I'm curious, do you think what's missing in some of these conversations is, because after the president made his comments, it's usually people like me, the talking heads, or politicians that are weighing in. We try and bring in experts like yourselves who can give a voice, but the Dr. Birx, the Dr. Fauci's, would you wish that they had more of a pronounced place in these conversations so these things didn't happen in vacuums and the public, depending on what channel they turn on, gets, whether a warning on this or an attaboy on the other channel? Are you worried that this is happening in a vacuum without science or medicine?
Well, I'm very far from the politics behind this, but so I don't have any idea of how these things are sort of organized or sorted out. I imagine that sometimes when people are asked questions, they are just responding. So I would definitely say that it's more it's reasonable. It's probably more professional to have these discussions, at least including or inclusive of professionals, but. Again, I don't know how these, what are the circumstances of these conversations that were held around hydroxy.
Dr. Jenkelson, I appreciate a few minutes today. Thank you so much.
All right, take care.